You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. All right, folks. Black people in about every state with racial data available have higher contraction rates and higher death rates from COVID-19. Those numbers could be about more than following the rules of social distancing. Guest believes they are structural conditions that create health disparities that make us more susceptible to contracting and dying from the virus. Joining us right now is Dr. Rashawn Ray, David M. Rubenstein Fellow at the Brookings Institution. Dr. Ray, first and foremost, we've all of a sudden, again, the last few days, a couple of days, the briefings from the White House, and they're talking about African Americans and other health issues and what creates that. And Fauci said, look, we're not going to be able to solve these things right now and overnight. But as I have been saying since this outbreak, this coronavirus has exposed so many elements, so many things in America that this nation has ignored, and it's now front and center. And this is one of them.
I mean, without a doubt. I mean, as we know, there's an old saying that when America catches a cold, black people get the flu. Well, in 2020, when America catches coronavirus, black people die. And part of what we have to realize is what's coming out of the White House, as well as a lot of mainstream media, is aiming to highlight these pre-existing conditions, trying to act as if black people have some type of defect or deficit. But instead, what I argue and what research overwhelmingly shows is that structural conditions actually manifest the underlying pre-existing conditions that we know to exist. Black people live in neighborhoods that are extremely unequal. They don't have healthy food options. They don't have green spaces. They don't have places to exercise. They don't have good lighting. They don't have places where they can get pharmacy prescriptions quickly. And then you couple that with the fact that black people are overrepresented when it comes to working these quote unquote new essential jobs. So black people represent about 20% of bus drivers, train drivers, grocery store workers, factory workers, and the like. And then, of course, we have to add on the climate issue and the fact that we live in areas with very high levels of lead, very high levels of pollutants, and then we deal with overcriminalization and policing. So until we deal with these structural conditions and the fact that we are dealing with a place issue, not necessarily just a race issue, what we need to do is actually to put triage places, testing places, treatment facilities in predominantly black neighborhoods. And I think that black churches can be a place that can really build on some of President Obama's legacy with some of these promise zones to build health equity zones in these particular facilities and in these neighborhoods to do something about what we're seeing.
Well, not only that, you have to deal with that because that impacts so many other different things. It impacts our health system. It impacts us economically. The reality is if you are able to improve the life conditions and the life expectancy of African Americans, now that changes outcomes in our neighborhoods. It changes. You're not going to see black men dying much earlier than black women. You're not going to see both dying earlier than white Americans as well. And so it's actually in the nation's best interest to really begin to deal with these things. But Dr. Ray, the problem is this here. America likes to look at something and say, okay, let's not even fix this. Let's touch upon this, but we're going to ignore the other 3 or 4 or 5 different things actually contributes to that. So you can focus on one thing, but if you don't deal with the other issues here, that ain't changing.
I mean, without a doubt, one of the big things we're seeing with the outcomes now is there's really an intersectional effect. Race and gender are coming together. So we knew very early on that it was an age issue. We now know that men are more likely to contract it. And now we know that black people are dying at very high rates. What this means is this virus is really colliding on the lives of black men. And part of what we have to realize is that if we actually want to change it, we have to deal with the structural conditions that underlay this. What this means is, first, we need to collect better data. Second, it means we need to set up places in black neighborhoods. Third, it means that we actually need to give people hazard pay. We actually need to give people a living wage. These sort of things will reduce the exposure that black people are under. And in the states that I've analyzed, black people are about 74% more likely to die from coronavirus than their percentage in the state. I mean, you look at Louisiana, it's over 70%, Chicago over 70%, Milwaukee County over 70%. This hasn't even hit the Deep South yet. So to your point, we can't put a Band-Aid on something that's a huge scar. Part of the American legacy is that racism is baked into the recipe of our country. And if we're actually going to deal with that, we need to change the recipe. This is an opportunity for the United States of America to correct this. But I think similar to what we've seen after the Civil War with the end of slavery, similar to the GI Bill after World War II, this will be another time where we won't see America properly deal with race in the way that they actually should.
Questions from our panel. First off, Erica, you got a question for Dr. Ray?
Yes, Dr. Ray, thank you so much for the work that you do. I'm not sure if you're familiar with Dougherty County, Albany, Georgia. They have reported in a timepiece today that Albany has the highest number of corona cases of those 50 deaths that have been reported in a town that's about 77,000, 90,000 with the county, that 50 of those people have been Black and women. So what do you see happening when you talk about the Deep South in the rural communities, especially in states like Georgia? People normally think about Atlanta, but when you start going down south into the agricultural rural areas, what are you seeing in ways that are really promising for places that are really understaffed, have a lot of people that live outside of the area that really depend on services like hospitals, things of that nature? What are you seeing in ways that do say, okay, things are happening well to help address coronavirus and make people more aware in perhaps areas where information doesn't flow as well? Or are you seeing things that are exponentially more problematic happen in those areas?
Yeah, that's a great question. I mean, I think unfortunately right now, things are potentially going to get bad in the Deep South. I grew up in Atlanta. I'm from Tennessee. I think about these areas all the time. And there are a couple of things that you highlighted that are important. First, most counties in the Deep South do not have one hospital bed in those counties. Not one hospital bed. And in this regard, we're just not talking about, rural people. We're talking about rural white people, rural Black people, in the Deep South, Mississippi, Alabama, Georgia, and the like. The second thing, when we were talking about these essential workers are more likely to also be women in certain professions, whether it be housekeeping, whether it be certain types of cashier and sort of service jobs. Black women are overexposed there. So essentially what we're doing is we are sending Black women to work, to get sick, to bring that sickness home to their communities because we know they're more likely to do the housework and the caregiving at home. I think what needs to happen is right now we need governors, we need mayors, we need county executives to take swift action to get CVS and Walgreens and other companies to set up mobile units in rural communities so that we can start getting people tested now before we have several New Orleans and several Louisianas. As we know, after Mardi Gras, most people who live in New Orleans, they work in the service industry and look forward to Mardi Gras. Well, of course, they did a shutdown after that, exposed all these people, particularly Black people in those areas. We're going to start to see that same thing throughout the Deep South in Arkansas and other places. Mayors like Frank Scott of Little Rock has been doing an excellent job. I mean, one policy he put in place as kids are being homeschooled is that he actually put a quarantine during the day. It was a great type of policy decision where he said from like 9 a.m. to 2 p.m. you actually have to be in the house doing your work. We need those type of progressive policies if we're going to actually get out of this and make sure that Black people don't continue to die from COVID-19.
Reese, your question for Dr. Ray.
Hi, Dr. Ray. One of the things that Senator Kamala Harris worked on before this pandemic was racial bias as it relates to the Black maternal health crisis. We know that part of who determines who gets testing is you have risk factors, and you also have judgments that are made based on the severity of the symptoms. We know based on racial biases in the system that oftentimes Black people aren't taken as seriously in terms of the severity of their symptoms. What can be done in terms of reevaluating the risk scoring or raising awareness to physicians or making it such that the limited testing that is available does take into account the race issues, the preconditions that Black people have, so that Black people can get the testing, so that they can get admitted, so that they do survive, And so that, part of the issue too is at some point there might be rationing where there are certain factors that will determine who gets care or not. Want to make sure that Black people don't get rationed out of healthcare because people feel like, well, they have all these risk factors. They're not a good candidate for surviving coronavirus.
You just made an excellent point. The maternal mortality rate, the gap between Black mothers having babies and white mothers having babies, is one of the most unfortunate and sad statistics in American history. You have women like Serena Williams and Beyonce going to have babies, almost dying, because there are a couple things that happen that research shows. First thing is, as you noted, Black patients are oftentimes spoken to instead of having a conversation with them. The second thing that actually happens is there is an empathy gap. There is a fascinating study that asks people on a scale from 1 to 10, what is your pain? Say a Black person and a white person says an 8. Research showed repeatedly that healthcare providers will give Black people less pain medication. And I kind of think about that in the context of my wife having our boys, and the fact that people might not necessarily be giving Black women pain medication. So part of what that means, particularly as we think about the fact that Black people only represent 4% of all physicians in the United States. That number hasn't changed in like 100 years. So when we look at the healthcare system, what we need is a complete overhaul. We need to continue to do implicit bias trainings with healthcare providers. Healthcare providers have some very, very warped stereotypes about our bodies. They don't think our blood coagulates the way that it does with white people. They think our skin is thicker like animals. I mean, a host of things that lead to some of the outcomes we see. And as it relates to COVID-19, there's one really, really big thing that's important. Pay attention to this language coming out of the White House, where they've been talking about if things get full, and we can see this in the Deep South, as hospitals get full, if they don't roll this out properly, they're going to start turning away people with pre-existing health conditions. Well, who is that going to impact? That's primarily going to impact Black people. So as Black people go to hospitals, and of course, that's even getting over the fact that we deal with medical mistrust and the fact that we have a legacy of Tuskegee and Henrietta Lacks and this sort of thing, that once we get to the hospital, we need to make sure that protocols are put in place, that we are treated equitably and get the same care and medication that other people do.
I got about 90 seconds before I go to my next guest. Greg Carr, your question for Dr. Ray.
Thank you, brother. It's Paul Robeson's birthday, so it's good to see all these alphas on this conversation since Paul Robeson was an alpha. Dr. Ray, I'm a big fan of yours, brother, and I'm thinking about one of your colleagues, Derek Hamilton at Ohio State, who has proposed that there should be structural fixes. You've identified structural fixes. What can the people watching this show do to push policymakers to engage in structural fixes so that, as we say, it's not a repeat of the New Deal, it's not a repeat of Reconstruction, it's not a repeat of the Great Society? How can we fix this structurally?
The structural conditions are what we need to focus on, right? And of course, if we lay it out, that's what alphas are definitely about. And part of thinking about that is what we need to do is there's an app. It's called The Countable. People should download it on their phone, The Countable. It allows you to put in your zip code. It pulls up all of your federal policymakers. You can send them emails, call their office, send them messages on a regular basis. Do that. Do that every day. Tell them what you want. And part of what we need here is raising the minimum wage. For example, in Tennessee, the minimum wage is $7.25. People can't even afford rent in Nashville, never alone health insurance coverage. So what we need to do is contact our policymakers, make sure not only our vote counts, but make sure our voice counts after we put them in office.
All right, then. Well, sir, I certainly appreciate it. Ma'am, I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.